Hello, this is a little explainer about Essential Parent and our eCare digital delivery system. So hopefully what you can see now is an outside view of the library, which is a digital library of video and article information, which is available to parents and that healthcare and early years teams can deliver direct to a parent's mobile phone via email or text. So the first thing I'm going to do is just tell you a little bit about the library itself. First of all, I should explain that Essential Parent, we are an ex-BBC team who made medical and science documentaries for BBC One with Professor Robert Winston, who narrates many of the videos that you can find in the library. My name is Rebecca Chico. I'm a child development PhD, and I'm also from Greater Manchester. Um, what we did as Essential Parent is we've built a digital library of video information on topics that are important to parents, and we've worked with expert groups. So if I go into a subject like breastfeeding, I'm just going to open that for you now. All of our breastfeeding, indeed all of our infant feeding information, formula feeding and introducing solids, is all presented and advised by UNICEF UK Baby Friendly. So if I go into any of these articles, it opens a video. You can see who the expert is. In this case, it's Sally Tedstone, who was a UNICEF UK Baby Friendly Initiative educator. The parent can see the video and play it straight away. They can scroll down to see more of the information on that subject, this is hand expressing breast milk, and they can also click over and choose different subjects in the library and look across and look at different subjects. So if I just go back into the general library, you can see it's broken down into different subjects, which into different stages, which makes sense for parents. So we have pregnancy stage, the baby stage. I'll just open the toddler stage. You can see that there's lots of information relevant to toddlers, like toddler oral health, and the child stage, which goes up to age 12. We also have information going all the way up 0 to 19, so we have information for teenagers as well. But this is the library I'm showing you at the minute, is the pilot library for school readiness, which was developed by Greater Manchester. So the other sort of groups that we work with, I've shown you the breastfeeding, but as we did at the BBC, we use evidence-based information, and we've worked with with expert organisations and all this work. So as I said, breastfeeding was done with UNICEF UK Baby Friendly. We have child health, which we did with the Royal College of Paediatrics and Child Health. All our stuff on baby first aid is a full course presented by the St John Ambulance. And as you look through the library, you'll see the groups that we've worked. We're now working with up to 30 groups, including groups like the Samaritans we're now NHS preferred supplier for safeguarding information, and we work with the NHS preferred sort of safeguarding expert organisations as well. So that's to just give you an overview of the topics that we cover, which are all sort of relevant to parents at different stages with their children. But what we've also done with our library is we've built it to create parent packs for all your universal visits that you offer to parents as part of your offer. So if I go to the new birth parent pack, you can see that it's a collection of topics and information which are relevant to someone who's just had a new baby. So unsurprisingly, there's lots of stuff about poo, changing nappies, how to bath babies, how to feed your baby, and how to bond with your baby, and games to play, as well as some information that we've worked with Greater Manchester to include some of their expert information that they've developed on talking and speech and language. So that's our sort of video content. But what we've also done, the library, we can sort of update it and curate it in any way that you need. So if I just draw your attention up to the top, we've also, for Berry in this example, we've added all Berry's leaflets that they would normally give out in the new birth leaflet pack. And when a parent clicks on that on their phone, it just literally opens as a PDF that they can keep forever and go back to refer to, whether it's on Safe Sleep or who the health visitors are in their area. We've also added other groups that we work with, like UNICEF, UK Baby Friendly, and the Institute of Health Visiting. We've added their leaflets, but importantly, every locality can curate the library to contain exactly what they want it to. So that can be their local information about their drop-in clinics and their offer. But also, if you've got sort of materials that you use, that you are licensed and registered to use, we can add those to the library for you so that all your offer can be delivered directly to a parent's phone, whether it's a link to a parenting course or whatever that is. So it's just to really understand that we can curate your locality library to reflect exactly what you want to be able to deliver to parents and to show to parents. We can also update it for you, as and when you say so. If a local leaflet has changed and you need to update the information, or there's a new vaccination that's come out, we can add that to the library and you can start delivering that immediately to parents. So that's a kind of a basic overview of the library. Now, so you've got that's the library tab button. Now, if I then go into the eCare button, this is the bit that the health professionals use. So I'm just going to sign in and pretend to be a health professional. And basically what that allows you to do is, you've got a little basket here. It just allows you to deliver everything in that library that you want to as a parent to a parent. So if I go into, you can search and find things in various ways. We have a simple search mechanism which allows you just to use the keyword of the thing that you're looking for, in this case parent pack, and you can see all the parent packs that we've made for the 8-stage mandated visits. So I'm just going to find the 6-week check, and I'm going to add that to my basket. When I tick the box, I check it's in the basket, and then I just quickly describe what I'm sending to the parent and put the parent's email address or mobile phone number in, and I press send, and then I get a record straight away to see that I've sent that to a parent. So as a practitioner, you can see what you've sent to who. You can also have a look at your parents and at any point go in and have a look and see exactly what they've had delivered to them. So if I look at this person, which is of course myself, I can have a look and just say, have I sent any parent packs to Rebecca Chico? And I can search for that. And I can see all the parent packs that I've sent, and then I can also see which ones have been opened. So you kind of have a good record. The parent registers by themselves. You don't have to do any registering. It's very simple. They receive a little link via email, and then they register with an email address and put in a mobile phone number and a simple password, and then they can get in at any time. So this is just to show that you can deliver any information that you want that we've got in the library. We also have an extra function which allows you to curate the system even further, which is the bundles that you can create. So if you have a certain subject that in your locality you want to develop a bundle or a bundle of information around, for example, like immunisation information or something around paediatric avoidance, it allows you to build out new little bundles of information that you can deliver directly to a parent. And you can either do that for yourself, or you can, if you're a team leader, you can make that for your entire organisation. So like an entire locality. For example, here's a little one that I've made about immunisations and the MMR vaccine, but you really can use the library and create whatever you want. We can also, you can also commission new material at any point, because we're a full production team, that can do video, podcasts, whatever you need, and written articles, as well as just adding stuff that you've already made. We also categorize our content by things like language. So anything that we have in there. So for instance, in Polish, I can see what we've got in Polish, and that can be delivered to the parent directly in Polish. Down the line, we are in the process of getting all our content translated into the top 10 most common second languages, so that parents will be able to get articles and subtitled information in those languages as well, and that will get rolled out and added to your library as and when it's in there. So what I've shown you is I've shown you the library, which is broken down by sort of age and stage of the child, and also by topic and by universal visit. I've shown you the eCare delivery system, which is the delivery system that all your practitioners use to deliver across agency to go to any parent. The parent then receives a link via text and email. They click on it and they get taken directly to that curated information that you want for the parent, whether it's associated with a universal visit or they've asked for particular help in a particular area, and a practitioner has delivered specific information to help them on any subject that they've come to them. The last thing I want to say is just to explain who can use the system. So if a locality signs up to use Essential Parent, you can have limitless accounts. So for instance, we've piloted this in Rochdale and Bury, and although it was done, it was sort of rolled out for health visitors and early years teams to deliver school readiness content and the sort of information around the mandated visits. They're now rolling it out beyond that so that the library can be used and other groups can deliver to parents. So for example, they are now going to be using it in schools, with school nurses, with private nurseries, who often parents go to. So they find it reassuring that the locality can provide a library of evidence-based information that the private nurseries can log in and deliver to parents, in the knowledge that it's kind of been curated and approved, so and it is evidence-based. Other groups that are going to be using it as well are GPs. There's a lot of interest around sort of paediatric avoidance and how creating bundles to try and support endeavours to reduce the amount of unnecessary attendance to either sort of A&E or the GP, to try and give parents confidence about some sort of ordinary everyday health and care that they could build their confidence around. And then also, because we have a lot of material in the pregnancy information, we very much recommend it to be used across maternity as well. So that means that at a locality you have a kind of consistency, that a parent will register on the system, and as their child, as they go from the antenatal period up to 19, they can be receiving information from different agencies and they get it all in one place. So that's a kind of general overview. Just to explain as well that the building of your library, your locality library, at the minute in Greater Manchester, if you sign up to use the system, Greater Manchester will cover the cost of building your locality library completely, and also cover the cost of all your training and support in the first year. So hopefully that gives you a bit of an idea about what the library is, how eCare delivers to parents, and also which practitioners can use the system in the locality. And basically the message is that it's limitless, so you can sort of add what you want to the library and any team can use it, from CAMS to maternity and everything in between. And they don't have to be local authority employees. If you have charities that you work with, or as I say, private preschools or whatever, you can sort of get them set up on the system, and we can make sure that they're trained, and then they can start delivering the sort of approved information that you have curated in your library. So I hope that's helpful, but please do get in touch when I send this video out to people. There should be a point of contact so that you can get back in touch with me, and I'd be happy to show you a sort of a longer demo, you or your colleagues, if anyone wants to have a bit more information about how the system works or what you can add to the library. I'd be very happy to show you. Anyway, thank you for your time.